Good afternoon, everybody, and welcome to the Nigeria Health Watch and Alive and Thrive Nutrition Policy Dialogue. Today, we're talking about the very important issue of nutrition in the country, and we're going to be reviewing the National Strategic Plan of Action. So as I mentioned, we're doing this in partnership with Alive and Thrive, and we're very, very pleased that they're part of this very important webinar. We're focusing this webinar on the National Strategic Plan of Action for Nutrition, which was developed to roll out between 2014 and 2019. And just for those who are not familiar with it, the National Strategic Plan of Action for Nutrition is a multi-sectorial planning instrument. And the aim of it is to provide an overview of the priority nutrition interventions and strategic directions for nutrition in the health sector for the period of 2014 to 2019 in Nigeria. And the overall objective is to improve the nutritional status of Nigerians with special focus on vulnerable groups, especially women of reproductive age and children under 5. We know that there's a lot of work to do. Our health indices in looking at nutrition are a cause for concern. So the National Strategic Plan of Action for Nutrition was developed really to enable the following objectives. One of them being to enhance capacity to deliver effective and appropriate nutrition interventions in Nigeria. We are aware of the disparities across the country in nutritional outcomes. So part of this plan was also to promote and strengthen research and monitoring and evaluation of nutritional projects, and to promote and facilitate community participation for nutrition interventions. We know that we have a very, country where we have got the federal and then the state governments, but at the community level, there are lots of interventions that are now in the responsibility of the community to take up those challenges and to address them. And we have a lot of development partners and the national and state governments who are really there to support in this. And so the aim of this, as we know, the plan is to eliminate hunger, food insecurity, and malnutrition in Nigeria, with specific targets on our SDGs, which we know by 2030, we have some specific targets to end malnutrition throughout the country. And this is aimed to measure progress and address a lot of the nutritional status challenges that we have in our population. So without further ado, I'll just briefly introduce you to our 3 panelists who are very, very excited to have today. We have, first of all, Ms. Ngozi Onuora, who is the nutrition specialist for UNICEF country office, Nigeria. So Ms. Onuora, we're very happy to have you. We also have Dr. Chris Isokpunwu, who is the Director of Nutrition and Senior Technical Assistant to the Honourable Minister of Health at the Federal Ministry of Health in Abuja. He also coordinates the Scaling Up Nutrition movement in Nigeria. And we're also pleased to have today the Nigeria coordinator, the acting nutrition coordinator for Scaling Up Nutrition Business Network in Nigeria, Ibiso Ivy King Harvey. Welcome. Ms. King Harvey is a results-oriented public health professional and a certified program manager, specializing in private sector engagement partnerships, building advocacy, and public health nutrition. Okay, so as I mentioned, the format of this webinar it's more of an interactive session where we ask our 3 delegates questions specific to the National Strategic Plan of Action for Nutrition. We're doing this webinar in partnership with Alive and Thrive, and we're very happy to have them support us in inviting the delegates and putting this together. So the first question I'll address to Dr. Chris Isokpunwu from the Ministry of Health. Welcome to this webinar again. So the first question is, you were at the forefront of the development and implementation of the National Strategic Plan of Action for Nutrition. What was the driving force behind its development? And what challenges did the government face in developing and implementing the action plan?
Thank you very much, Vivian. Good afternoon, everybody. Actually, for some time, we realized that malnutrition was a huge challenge. First of all, there's the fact that under 5 mortality rate was high, maternal mortality rate is high. We focused on a lot of child health services. We actually at some point didn't realize how much malnutrition could contribute to this. Over time, there had been neglect in the funding for nutrition until 2011 in November, when the country joined the Scaling Up Nutrition movement. And that actually began to make a lot of things happen, because the Scaling Up Nutrition movement brought together a lot of partners, government, private sector, development partners, all aligned towards a common goal. But for us in Nigeria, we didn't have a common plan. We had a national nutrition policy that was over 10 years old, and we had a nutrition strategic plan that actually never took off. We also had, the policy was actually old and data wasn't really quite forthcoming. And so first thing was, if we want to begin to address nutrition, we need to have a plan that all of us can work with. So we got together, brought together our partners and support, UNICEF, the World Bank, GAIN, and a lot more other partners at that time. We all started discussions around developing a national strategic plan of action. Initially, it was supposed to be national, but at that time, there wasn't enough capacity at the Ministry of Budget and National Planning. So the health sector decided, okay, let's develop this plan, because again, nutrition is largely domiciled in the health sector. And so the plan came up. It's a plan of 6, like I usually like to call it, 6 targets, 6 objectives, 6 priority areas, and 6 strategies to achieve the plan. There were challenges. First was, everybody wanted everything to be on the plan, but we needed to prioritize. What are those high impact interventions that can actually deliver to us what the gains of malnutrition, the gains of nutrition, and also contribute to reducing under 5 mortality, which is the index for measuring the developmental index in the first place. But again, we knew that all Nigerians, as at that time about 14 million Nigerians were hungry, and under 5 stunting among children, 37% of children at that time were also stunted. Wasting was high. According to the DHL, it was about 18% at that time, and underweight was 29%. So we needed to focus. And so the priority areas were articulated first to begin with. So we agreed on treating children with severe acute malnutrition, focus on infant and young child feeding, look at the maternal nutrition, and then micronutrient deficiency control was also very crucial, because it contributed also largely to stunting. And also data had to be part of it, had to be data driven. And we looked again at those diet-related non-communicable diseases. So we looked at those 6 priority areas, and now developed strategies that we can use to achieve the priority areas. The strategies then included behavior change communication. We need to have service delivered in an appropriate manner. We needed capacity development for health workers. We also talked about resource mobilization, because money was required to do this. And research was also very critical, with monitoring and evaluation. Those were the different strategies that we needed to use. And coordination was a huge challenge, and it still is. And this plan was also supposed to strengthen coordination. So in 2014, we had a final plan, and it's not just to have a plan, you have to have it costed. And so this plan was costed. We costed 10 very specific high impact interventions and across the country. And it was disaggregated into what will it cost each state to implement these high impact interventions, at what different levels, at different delivery platforms. So we costed treatment of children with severe acute malnutrition, vitamin A supplementation, deworming, iron and folic acid supplementation for women, fortification, food fortification with iron, salt iodization. We looked at zinc supplementation and all of them, including community nutrition programs in terms of behavior change communication. All of these 10 interventions were costed, and the total cost was put at $912 million US at that time over a period of 5 years. So the next move was, how do we get everybody around implementing the plan? I think the Sun Movement provided a platform, a good opportunity for all of us to come together. And the plan was now became a national plan. We were able to go beyond the sectors. And the agri sector took a leap from there. Budget and national planning was strengthened to ensure multi-sectoral collaboration, and then the review of the national policy. So by and large, that's how we've come with the development of the National Strategic Plan of Action for Nutrition.
Okay, fantastic. So in your view, how was this strategic plan received by partners working in the nutrition space? And were there any limitations in the implementation that were identified since its implementation? Thank you.
Thank you very much. First, the development of the plan went through wide consultative processes. Everybody had to be on board and had to align with that plan. So right from the onset, it was through consultative process. How do we determine the priorities? Everybody had to agree, okay, these are the priority areas we needed to align with. How do we determine the targets, the objectives? What are the objectives? All of these we had to do through wide consultations, participation of everybody, including those at the subnational level in the states. And so by the time the document was ready, everybody was looking forward to it because it brought everybody together now around a common space. It has a plan that each and every one of us could relate with, could identify with. Even though it was a health sector response plan, there were still some components of it that were outside the health sector, that were multi-sectoral. For example, the food fortification, the iodization of salt, even the micronutrient powder component. All of these were able to bring everybody together. So secondly, because we're working on the Sun Movement multi-stakeholder platform, everybody keyed into this common plan. It had been developed through a transparent process, all-inclusive, without any form of exclusion. So yes, the question was, how was it received? It was well received, it was publicized, and it was actually the first time a country like Nigeria was among the Sun Movement. We were among the very first countries within a short period of time that had come out with a plan. I may have forgotten to mention that the whole process started with a National Nutrition Summit that was held in February 2012. So at that summit, everybody had come to a consensus that we needed to review the policy and we needed to develop the plan. So a policy was first developed, a draft policy for the health sector before the plan was, the development of the plan started. So in 2014, when the plan was signed into effect, everybody was now on board and ready for its implementation.
Fantastic.
Okay, so if I can just add to what Dr. Chris said, Vivian, because I know you asked me the question as well. So I would say that, yes, just like Dr. Chris has highlighted, it was a very consultative approach that was used. So that speaks to the reception by different stakeholders. And it's quite a comprehensive document. So when you look at the objectives, the priority areas, the focus, the cross-cutting strategies that were outlined, and even the stakeholders in terms of the roles and responsibilities that were listed, I mean, it's very comprehensive. And also considering right now the increase in overweight and obesity and subsequent increase in NCDs. The NSPAN highlights diet-related NCDs as one of the priority areas. So that also speaks to its comprehensive nature. Then also, if I might add to that, as Sun Business Network, being part of the Sun movement, is being convened in Nigeria by the Global Alliance for Improved Nutrition. And speaking about GAIN and SBN specifically, the NSPAN is one of the documents that we have utilized, or we utilize when we're putting together strategies and implementation plans for our projects. Then in terms of the limitation, I wouldn't really say it's limited in its content, but rather limited in the overall implementation. So when we speak about how many states have actually domesticated this plan, and even if it's domesticated, how well is it being implemented? Has more public funding been allocated to nutrition activities, and were those funds disbursed? So well, overall, I would say it's a very comprehensive document in terms of the health sector's response, but health systems can only sort of complement nutrition programs and not deliver it wholly. So perhaps some of the limitations I just spoke about might have been addressed if the multi-sectoral plan of action for nutrition was finalized and being implemented at the same time by the different ministries. Thank you.
Thank you very much for that addition. And I think I like the way you emphasize the need for states to implement it and the need for multi-sectorial collaboration in ensuring that such plans are actually implemented. Thank you for this. My next question is now to Ms. Ngozi Onuora. As the UNICEF project manager in Dhaka, I want to find out a bit about how well, or looking at some of the indices of nutritional outcomes in the country. Is there evidence that the plan evidence that the plan had an impact? Because looking at the latest NDHS survey data, we see that stunting under children was 36.8 in 2013 and has remained at 36.8. Whereas wasting in children under 5, looking at NDHS, has gone from 18% to 6.8%. So in your view, would you think the NSPAN contributed to better nutritional outcomes for the country, given the indices I've just highlighted?
Thank you very much, Vivian, for the question. Actually, Ivy would have gone a little bit in depth into what I want to say. If I am asked if I would say that it has contributed, I would say yes to an extent. And I would want to discuss the extent by looking at the targets of the NSPAN. Like Dr. Chris said, NSPAN has set out 6 targets to be achieved between that 2014 to 2019. And one of them, like you mentioned, is to reduce the number of under 5 stunting, under 5 children who are stunted by 20% by 2019. The second one is to reduce low birth weight by 15% by 2019. And we all know that low birth weight has an elaborate, it talks about a compound effect of several public health problems, apart from long-term malnutrition for mothers, poor health infrastructures, and poor maternal and child care, also inclusive. Apart from that too, we also looked at to reducing and maintaining childhood wasting to less than 10% by 2019. And the fourth one is to reduce anemia in women of reproductive age by 50%. Increase exclusive breastfeeding rates to 50% by 2019, as well as the overweight. as has been mentioned. When you look at these indices, comparing it with the outcomes of the NDHS of 2018, you have to have a base from where you are going. So if you have to come on a comparative basis, when you look at the statistics like we mentioned of 2013, we started with 36.8, which is 37% stunting level in 2013, which is still maintained in 2018. So for us, the NSPAM, even though there have been a lot of activities undertaken by both partners and the government sectors in various sectors, the stunting level is still at where it is, and it's still a major public health problem to us and to the global world. Reduction in low birth weight, actually in the second target, did not actually also get improved, because in 2013 it was 8%. They just got down by 1%, which is 7% by 2018. The same also applies to reduction in anemia for women, because by 2018, we still have 58% of women of childbearing age anemic. That means that 1 out of every 2 Nigerian women of reproductive age has anemia. But like you rightly said, the wasting load has decreased from 18% to 7%. Remember that the plan said that they want to reduce that and maintain wasting below 10%. So when we are looking at the wasting status, it means that NSPAM has helped us to achieve a reduction and has maintained it at below 10% scale. The same applies to exclusive breastfeeding rates. Exclusive breastfeeding rates in 2013 was 17%, but by 2018, it stands at 29%. Even though it has not gotten to the level of 50%, which is the global expectations of the World Health Assembly targets, and the NSPAM target as well, but there is a little improvement to that. But remember that nutrition, like Ivy actually said, nutrition, the health sector specific plan cannot address nutrition because it's a multifaceted act. And that is why the coordination body is domiciled at the National Ministry of Budget and National Planning. But we cannot say the limitations are here, because we can, part of the NSPAM document in its strategic areas also included behavioral change communication and other micronutrient fortification and others. We have not talked about those ones. Even though in vitamin A supplementation, we have not achieved much, because we expect that by UNICEF standard, 70% coverage is the minimum expectation on vitamin A supplementation that is required for a country to begin to exhibit change in under 5 mortality. But we are moving there. Some of our states are up to 60% and all that. But this is, if you look at all those indices, you cannot entirely say that NSPAM has not, contributed, because that was the major document that was available after 2015 when stakeholders came on board, and there has been an increased partnership. There has been a lot of generated political environment, a high momentum of political environment and awareness in place for nutrition. And we are moving towards resource mobilization. And in resource, we have hopes for resource mobilization. So having put nutrition coming up, seen it coming up in the government agenda at that momentum, we will not say entirely that NSPAM has not contributed. So I'm of the opinion that NSPAM has given a little push to the nutritional outcomes, as evidenced by the discussions x-rayed. Thank you so much.
Thank you for that, Ms. Onuora. As you mentioned, vitamin A supplementation has gone up from 41.3 to 45.3, so we have shown some improvement. And also, you're highlighting the importance of resource mobilization. We haven't mentioned that just yet. A lot of these action plans require support from government, especially at the state level, to ensure they're implemented. Because really, as we found across other issues in our health sector, without adequate funding, we really are not making any progress. So that government support is always critical. Okay, my next question again looks at the importance of multi-sectorial collaboration, especially highlighted by IB, and especially the role of the private sector. So my next question, very briefly, to Dr. Chris, is looking at public-private partnerships and collaboration with NGO. How well do you think, or how did the government really, how well do you think the government collaborated with the private sector and NGOs in driving the implementation of NSPAN? And I also asked very briefly, at the state level, private sector at the state level is something we don't often mention enough of. So in your view, how well or how much did the government sector collaborate with the private sector for NSPAN? Thank you.
Thank you very much. We have a lot of private sector engagement for the since the implementation of the NSPAN. As IB just said earlier on, they coordinate the business platform, the business sector platform for nutrition. Before now, businesses didn't really know, think they had any business with nutrition. The businesses that had anything to do with nutrition were those that were involved with food fortification. But over time, we've begun to bring in the aspect of the small and medium scale food processors. We've brought in the banking industries, making them realize the importance of promoting nutrition. One of the things we also realized over the period was the mutual distrust between industry and government. We had to deal with the issues relating to the code, where some infant formula manufacturers were running foul of the code and they were seen as their enemies, shouldn't be drawn close. But this NSPAN provided a platform for engagement for progress. If we are going to work together, we must understand, we must have the rules, bring out the rules for engagement. And the Sun movement had something like that. But we haven't gotten there yet. There's still a lot to do in private sector engagement. We need the big businesses, and we're targeting those big businesses. Over time, we've shown commitment. Government has shown commitment by increasing resources, especially from the health sector, increasing resources for nutrition. Government have shown commitment by extending the hands to the industry, trying to get industry, provide the level playing ground and enabling environment for private sector at different levels. And we see the involvement of private sector, albeit through their foundations and through implementing partners. A clear example and a big push for us is the Aliko Dangote Foundation, which is of course a product of business, and investing heavily for nutrition. We have a lot promises and more interests being generated by business for the manufacturing of ready-to-use therapeutic food, for micronutrient powders production and manufacturing. The manufacturers of premixes are becoming more responsive, understanding that manufacturing premixes goes to just beyond business, but it actually involves control of micronutrient deficiencies, which is a huge problem, of course, as you know. We're beginning to get a lot more consumer insights, R&Ds from industries towards developing nutritious food, not just for children, for mothers, as well as for the whole society. Retail shops are becoming more responsive because, again, we've also strengthened the regulation. I must say here that regulations have been strengthened around food and food safety, nutrition, the labeling rules that involves food through the national agency and NAFDAC. We have more interest coming from Standards Organization of Nigeria, as well as the FCCPC, that's the Federal Competitive Consumer and Consumer Protection Council, becoming more and more responsive to the idea of providing Nigerians with nutritious food. And these organizations engage with private sector. And so with their constant engagement, regulations, enlightenment, industries, private sectors, the private sector is becoming more engaged. The Sun Business Network, which is run by GAIN, the Global Alliance for Improved Nutrition, has actually led our front under the Scaling Up Nutrition movement to bring in industries, small scale, large scale, to a round table. You will understand that twice between December last year and now, Bill and Mr. Gates and Alhaji Aliko Dangote have convened meetings of businesses towards promoting, making commitments to promote food fortification in Nigeria. They take one step at a time. They take one intervention at a time and commit to achieving that. And we're making real progress. And I think the plan contributed to that initiative.
Okay, thank you very much for that, Dr. Chris. In a similar vein, continuing on the discussions with multi-sectorial collaboration, this question is for Mrs. Onuora. One of the objectives that we've highlighted of NSPAN is to promote and strengthen nutrition coordination and collaboration. How has UNICEF and other partners worked to strengthen coordination and collaboration for better outcomes?
Thank you very much for that question. UNICEF does not work as a separate organization. UNICEF works as part of the nutrition team for Nigeria. And over time, part of the portfolios of partners, UNICEF and partners in supporting government to roll out its nutrition activities and sustain it, has been to provide some nutrition enablers like policy, advocacy, and partnerships. Like Chris mentioned, the inception of that development of the NSPAN saw a lot of partnerships. UNICEF was at the core of such partnerships in terms of provision of funds, in terms of technical support in the development of the NSPAN. And therefore, there also, before the inception of this development, we also recognize that it was mentioned that in 2012, there was a nutrition networking meeting. And that nutrition networking meeting was supposed to be a coordination platform. And that was also majorly supported by UNICEF and partners to ensure that the coordination system is put in place. And there was also a decision of having what we call the coordination agency for the nutrition being a multi-sectoral activity. The coordination body was agreed to be domiciled at the Ministry of Budget and National Planning. And down the line at the state levels, it is at the Ministry of Budget and Economic Planning. And at that platform, there is a National Coordination Committee, National Committee on Food and Nutrition, as well as trickling down the line as the state committees on food and nutrition, and also local government committees on food and nutrition also. We are all planned and being strengthened. So UNICEF used such existing committees as an entry point with partners to ensure that we sustain them and build capacities. A lot of capacity building to strengthen the coordination roles of these partners, including the health ministries, agri sectors, and others. All the relevant agencies and partners are in this committee, and bringing on board all their technical inputs to ensure that nutrition is moved forward. Part of the activities also of these coordination bodies to ensure advocacy that can bring about funding, nutrition funding for nutrition, specific nutrition budgets in line ministries to ensure that nutrition activities are being funded, because funding, like you mentioned before, is a major bottleneck in implementation of NSPAN. And that was part of the reason why we cannot say we actually met the target of the NSPAN. Apart from that, political will is another one. And part of the coordination activities of UNICEF is to ensure that we leverage on the existence of the legislative and the executive arms of government, their powers in ensuring to create massive awareness by engaging even the governors forum and by ensuring that we, build capacity of the coordination bodies to ensure that advocacy effects and strategies are mapped out and policies are developed down this line. For instance, presentation of the ENSPAM is a key one. It was not done in isolation. We must recognize the efforts of various organizations that has contributed in the presentation of ENSPAM, like the Civil Society Scaling Up Nutrition in Nigeria, who at their platform, the public presentation of ENSPAM was done in 2015. But UNICEF was also, and partners were also at the core. Alive and Tribe was coming on board then, they were there, FHI 360, Sun Business Network, and all partners, including the government partners who are also at the forefront, were there to ensure that there was a public presentation and that this ENSPAM keeps rolling. But it doesn't end there. If we do not have policies even at the state level, we cannot implement. And the approval of policies are key. Therefore, UNICEF has supported all the states in the Federation through the UNICEF field offices to begin to develop multi-sectoral plans adopted from the ENSPAM and the draft multi-sectoral plan of action and the National Policy on Food and Nutrition. They have supported them in quarterly meetings, coordinate quarterly meetings. We have also facilitated identification of champions, using our first ladies as champions to enhance the coordination level of the agencies and to enhance, create a high momentum of political awareness on this. And this has brought us to a platform where the garnering political environment, we have been able now to have hope on leveraging of domestic resources to be implementing nutrition henceforth. And that's going to be our focus going forth. So coordination mechanisms has been on. It is true that we need to bring on board private sector coordination, a transformational partnership that can, seek to add value by strengthening the synergy among sectors and other initiatives of government and partners. But we have gone a long way already. And UNICEF is always at the forefront, behind, supporting governments to do this, initiating and providing both technical support and financial support, as well as other partners are also doing. Part of it is what we are doing today. The Nigerian Health Watch, the Alive and Tribe, or if you look at the retinue, the list of participants, you will see that all stakeholders that are involved in the nutrition discourse landscape in the country are represented. And harnessing the expertise of individual sectors to bring on board and bring on board our strategies and work as in synergy, work as a convergence approach would actually bring a better outcome for our children in Nigeria. And that is the going forth, the plans. Chris has given an elaborate explanation on plans, for a transformational partnership with the private sector, the civil society angle, including community-based organizations. And these people, when they come on board, will have to bring about more sustainability, more ownership of programs, and then we will begin to experience better outcomes for our children at all levels. Thank you.
Thank you very much for that, Mrs. Onuora. My next question is to Ibiso, and listening to what Ms. Onuora mentioned about multi-sectoral collaboration. I mean, Ms. Onuora, you literally listed almost anybody and everybody who can be involved in the implementation of a plan, from CSOs, the private sector, influencers like the First Lady. I know the Future Assured are quite active in this. So government, legislations, legislative branch, etc.
Sorry, I can't hear you.
Sorry. Okay, yeah, so I was saying, in addition to all the different stakeholders, partners that Ms. Onuora has mentioned, and in implementation of NSPAN and improving nutritional outcomes in Nigeria, are there further opportunities that can be explored, or other critical individuals who can assist, not just with NSPAN, but literally in improving, helping to improve nutritional outcomes in the country? Because it seems we are working across different sectors, working with different stakeholders. Are we limiting ourselves, or are there other sectors that could be involved that we're not involving as much in improving nutritional outcomes in Nigeria?
Okay, so yes, there have been various stakeholders that have been involved, and that will still need to be involved. So if I speak to the private sector, just like Dr. Chris highlighted, that it was a situation whereby most companies didn't realize the essence of nutrition. You have businesses that don't consider themselves, they make food and beverages, but they don't consider themselves as adding value in the nutrition space. In fact, we've had a business say that, yes, I produce food, but what exactly is nutrition? And that is why in 2016, the Sun Business Network was launched. And right now, we're not just focusing on just the big businesses. We have seen the importance of supporting the SMEs, because most of the foods that are consumed or distributed or produced are from the SMEs. So how do we better support them and bring them into this understanding of nutrition to collaborate more and improve nutrition in Nigeria? And if we look at the health system as well, to ensure like continuous delivery of essential programs such as breastfeeding, we are working towards enlightening the SMEs that produce complementary foods to ensure that they are not marketing their products to children less than 2 years. And we have been able to have some successes in that aspect, where businesses have changed their marketing approach. And also, I believe we need to work together to see how we can create demand for nutritious foods. How do we make it aspirational for individuals? Because, I mean, if there's no request for those nutritious foods, then obviously the private sector, who are also focused on making gains, will not produce what will not be bought. So we need to all come together and strengthen every coordinating body or governance structure for nutrition and sort of build on our wins. So even at the state level, I mean, we need to go down to the community level, the local government level, and see how together we can work on things like behavior change communication. I mean, because if you have a plan that for example, local government chairman is not picking up or utilizing or even understands, then we cannot speak to the success of what we are doing. So we need to conduct researches. We need to bring in the academia. We need to bring the academia and the research organizations or bodies together to form their own network. So to be part of the Sun movement in Nigeria, to conduct ethnographic studies for states or local governments to really contextualize what this plan means for each local government or each state. That is the way we can really ensure success in this. And also, I guess going forward, we need to also take into consideration as we are reviewing the plan and putting together a new one. So reports, or even looking at the SDGs. So it's about strengthening what already exists and then bringing in more players, even at the state and local government level, to work together to improve nutrition in Nigeria. Thank you.
Okay, thank you very much for that, Ibiso. I think I like the way you mentioned the importance of demand for nutritious foods. In 2017, Nigeria Health Watch held a policy dialogue looking at local alternatives. We don't look enough at our local foods in Nigeria. Many of them are nutritious. We did some work in Zamfara, and where there's a lot of malnutrition, and they have a lot of nutritious foods, but it's just that awareness at the community level, which foods are nutritious, and it's education as well. So it'd be good to hear a bit more about that as we progress. So the last session really looks at what we're all facing. As you can see, many of us are working from home and we're all having to change our lifestyles because of COVID. But COVID, as we know, has had an impact on nutrition in Nigeria. We may not have the granular data yet, but it's important that we highlight and we discuss what impact this has had. So my next question is to Dr. Chris. In view of the COVID-19 pandemic, what food security and nutrition challenges has this presented to the Nigerian government, especially in our efforts to improve nutritional outcomes? Do we sense that all the gains that have been made will be at risk because of food security challenges and nutritional challenges we now face in the country? Thank you.
Yeah, thank you very much. In fact, when the outbreak began, we realized that we anticipated that if no action is taken, there will be impact on food security and nutrition. What are those impacts? You have impact on the individual at the individual level, you have impact at the community level, and in a public health level as well. When people are down with illnesses, the energy consumption is high, and that means if they do not replenish, eat adequate nutritious food, they might actually become malnourished as well, just from being sick. Then there was a consequence of the lockdown. People lost livelihoods, people could not go to work, we could not move food from the market, prices would go up, and all of that. And so that would bring in food security issues in terms of availability and accessibility. And then I've already mentioned utilization in terms of in the body, how they use the food in their body. So when we are realizing this, we immediately started consultations and discussions. We brought together many of our partners across sectors to discuss what interventions we should prioritize. Needless to say that because of the lockdown, because of the infection, a lot of routine services also were grounded. So there were multifaceted action that if we do not do anything about it, it's going to, like you said, we'll lose the gains. So we came together and developed quickly within a period of 2 weeks with everybody, all of us working together as partners. So we have developed a Nigeria nutrition response plan for COVID-19. And that has been shared with many of our partners. We're actually in the process of printing copies that we could, for those who want to have it. And I think we probably are going to send some copies, put the copies online, put it online so that many others can have access to it. In that plan, we've looked at behavioral change communication, what we might call risk communication from the nutrition point of view. That usually will be handled by our partners who work around risk communication, especially partners like Alive and Thrive. We are scaling up the interventions on the Zero Water campaign because people need to know that even at this time, exclusive breastfeeding needs to continue because many were afraid that mothers who are positive should not breastfeed their children. And evidence shows that the gains of breastfeeding the child, even by a mother who has COVID-19, is higher than not breastfeeding, especially when she takes the necessary precautions of using the personal protective equipment like face mask and washing her hands and using hand sanitizers appropriately. So beyond that, we looked at actions that can be taken to ensure continuity of service, providing PPEs for health workers to ensure that treatment of children with severe acute malnutrition continues in the health facilities. We prioritize interventions that should still continue to go on in the facilities irrespective of COVID-19, like treatment of severe acute malnutrition, nutrition counseling and support, micronutrient powders, vitamin A supplementation, and growth monitoring, as it were, but ensuring that the health workers are protected, which is a global action taken by the Ministry of Health. At the agri sector, there were interventions to ensure movement of foodstuff across borders from the point of production to the market, ensuring that this is not truncated in order to maintain the supply chain, and not just maintaining the supply chain, ensuring that availability and accessibility, which are components of food security, remains stable in terms of, so talking about stability. The agri sector is doing that. And of course, all our partners continue to play our roles. The usual challenge is, what do we do at the sub-national level? Even with the implementation of the plan, it's always been a challenge getting those of us who work in the state to effectively implement. We have the human resources in some of these states, but the enabling environment is not enough. How many states have provided resources for promotion of for addressing malnutrition in the various states, except for some of the fire brigade actions that we see for some states when we confront them with children who are severely acutely malnourished. So while policies are in place, implementation of these policies, which are the responsibilities at the subnational level, usually becomes lacking. But our partners like UNICEF, Alive and Thrive, GAIN, have continued to support governments actions towards strengthening advocacy so that we can mobilize resources. For example, when I said that this plan costs 912 million, it's going to cost us 912 million US dollars, which at that time was about 180 billion naira or thereabout, as at the time we developed the plan. More than 60% of that fund was supposed to be mobilized from the subnational level because they were going to be implemented at the states. But we were not able to mobilize as much resources. However, I would say that the plan did its best, did well because we moved from, at the federal level, we moved from almost 2 million naira per annum allocation to about 1.2 billion naira in 2019. That's a huge leap, and it made a lot of effect and impact, such that we were able to reduce wasting rate by 61%, when our target was just to reduce wasting rate by about to less than 10%. Our wasting rate moved from 18% to 6.8%, like you read out in your comment. So for COVID-19, we still continue to implement the plan, but we prioritize those interventions that are critical to survival, ensuring food security, ensuring adequate nutrition, ensuring the pipeline for supply chain for food, access to food, to good nutritious food, remains open. Thank you.
Okay, thank you very much for that, Dr. Chris. My next question is to Ibiso. Looking at the role of the private sector in this COVID-19 pandemic, one word that I think is on the tongue of many Nigerians is the word palliatives. This was led largely by the Ministry for Humanitarian Affairs, but the private sector also played a role in this. And we hear reports of private sector organizations donating food items, but normally, people just donate whatever is possible. And the challenge, sometimes the food that they donate may not always be the most nutritious. In your view, do you think this could have been better managed? Or do you think that when private sector organizations donate food, that more guidance or support should be given in saying what types of foods should be donated or given that the people they're donating to usually have very poor nutritional status?
Okay, so just like you rightly said, when there is a pandemic and the private sector decides to donate, I mean, they donate what they have, and I would actually like to commend every private sector company that supported the government's efforts in the food distribution or in the palliatives, and well, even the individuals and organizations, not just the private sector. And I mean, yes, it could have been better managed. Like Dr. Chris spoke about the Nigeria Food and Nutrition Response Plan that was put together. In my opinion, we could have put this document together earlier, and it's a document that is quite rich in information. And some of the interventions or activities area that we listed was, for example, developing a minimum package of food groups that government and partners can use for the palliatives. We have things like supporting distribution of nutritious food baskets, promoting the inclusion of animal source proteins. So this kind of guidelines, if we had put together this earlier and even running with it even at the moment, because no time is too late, it would have gone a long way to really shape the sort of foods provided to people. And also we could have as well harness the power of social media or mass media for communicating key messages to sort of enlighten the public on the importance of healthy diets with the recipes that they have locally. I mean, for some time, markets were closed and some foods couldn't get into other parts of the state, so you're stuck with what you have in your state. So that education, that enlightenment, that increasing the awareness of the general populace on the importance of that nutritional diverse diet could have been done. And we also noticed that there were a lot of myths and misconceptions on the types of foods that can prevent COVID-19. So we could have dispelled that using the mass media as well. And I think another way we could have managed this better is if, for example, the Sun movement is more present at the state level. So I know either last year or 2 years ago, I know we had a launch of this in Delta State, but we need to work in more states and identify champions, because the Sun movement has a civil society network, business network, has government, has different bodies. So when we put it at the state level and then you have champions for each of these that are the voices or the driving force, in such a situation as COVID presented, we would have been able to utilize this voice or these champions to really speak about what kind of palliatives should be put together for people. And then the state committees for food and nutrition as well, not just the Sun movement. We have nutrition focal person in each state, I believe. And we need to strengthen their capacity to work closely with the government of their states so that we can manage such situations better. Because I believe that when coordinating bodies are strengthened, even at the state level, it will go a long way to be able to approach sort of the COVID-19 presidential task force or governors, media, whoever, to be able to get the message across there. So I believe that's the way we could have better managed that situation. Thank you.
Okay, thank you for that, Vivi. So I think, it's never too late. And as you said, the private sector really came to the table in supporting, with the COVID-19 pandemic. And, one of the things we're discussing, the NSPAN, the critical word is action. You mentioned the use of social media to advise people on nutritious foods to eat. I think, going forwards, many organizations like ourselves, Nigeria Health Watch, Sun Business Network, and the Ministry of Health can actually do that, can put out messaging to people on what nutritious foods they should eat, especially now that, finances are very tight. So helping people look at the local foods that they can actually eat that are nutritious, but are not too expensive. I think that would actually be a great intervention, using all our different platforms to disseminate that messaging. And of course, led by, our Ministry of Health. Okay, my final question, sorry to take this is taking so long. We haven't gotten to the panel, the delegates yet, is very quickly, Mrs. Onuora. In the context of COVID-19, how has this impacted on UNICEF's programs at the state level? What challenges have you encountered?
You will notice that this question is related to actually what Dr. Chris earlier said. The coronavirus pandemic, does not show its effect only in biomedical issues, but it's, realized to have impact on the food value chain, ranging from agriculture to individual nutritional status. At the onset of this, The initial and major challenge, borders around the health and social sensitivities that will impact nutrition. So UNICEF quickly and tried to look at these social health and social sensitivities that can impact on nutrition to be able to decide what are the anticipated impacts for us to be able to know where to go. But we quickly identified that there are phases of this COVID. There's the immediate, the medium, and the long-term impact. That is the short-term duration, which we have also gone to the end. Because the first 3 months is the short-term, which is the immediate duration. We are now at the second phase. But at that, we have looked at characteristics of the COVID-19 on these health and social sensitivities, which include restricted access to health services, a delay in the agricultural seasons, movement of populations from the cities to the communities, as well as the closure of borders, like Dr. Chris mentioned. When you look at the restrictions imposed on access to health services because of physical distancing and all those protective measures that were put in place initially by the government at all globally and including in Nigeria, it was a very huge bottleneck for health implementation activities, even for mothers to access health services, especially pregnant women accessing health services was a very difficult problem because there was health workers who are not going. The majority of the populace were afraid to even visit health facilities to access care. And that also has a great impact on our infant and young child feeding because during these antenatal periods when mothers come for health care promotion, they gain knowledge on appropriate infant and young child feeding practices like exclusive breastfeeding. And of course, that is when we meet them for their infant and young child feeding practice, apart from the community-based structures. And that also has a great impact. You already know that our health systems are overburdened. Our health system infrastructures does not meet standards. When you look at cross-border, you know how many people access health services at a given time, let alone where there's also a restriction. That has a direct impact on an infant and young child feeding practices as well as nutritional status at home. So also the delay in agri season, like you mentioned on the food value chain systems, we notice doing a baseline assessment of these impacts x-rayed that the pandemic will have a great toll affecting up to 40 to maybe 60% of our children, of the populace, mothers and children, especially the most vulnerable, on having food on the table. Because even their home gardens going towards their farms was also difficult and there was delay. A lot of people are also outside homes. These were all put into closure of borders. Apart from country closure, we have interstate closures that was affecting movement of food, like Chris mentioned too. So these were all what UNICEF puts into consideration when they were planning on their various interventions. And of course, meeting with government partners. You already heard Ivy say that we were expecting the health sector to come up on board on time. There was a great delay. The nutrition response plan for COVID-19 came on board in April, and that was well into the second month. By that time, UNICEF had, tried to find out means of online communication with the state counterparts because we were not able also to go to provide physical technical support. So we were having online discussions. The Zoom meeting became very popular among state counterparts. And fortunately, it's amazing to observe that even the local government nutrition counterparts were able to log into Zoom meetings to be able to explain. It was imposing a lot of difficulties for us because they said sit down to work, but sitting at home to work was also a big challenge because trying to do that, to communicate with the states online and all that, and you are not seeing them. The issue of not having PPEs as well at the health facility level also was a big handicap in provision of CMAM services. The communities were not meeting for community-based IYCF. We now resorted into modern MUAC screening processes, but this is not in everywhere. It's only seen in some states in northern Nigeria. And you know, when mothers, how can you educate today as we are having this meeting? The webinar on training on modern MUAC screening is going on at the regional level, which is also late, coming at the second phase. If we had those things in place earlier, it would have come on board. It would have been used within the online process to continue to, you know, be able to harness. We have found out that even these gains, little achievement we have made in the end spam with the reduction of wasting. You can see a lot of cases of SAM coming up, trickling from, including in the southern states, where we think we don't have such. But it's all over the place now. And that is going to be a lot of toll on us, reverting the gains already made in nutrition. So we are looking at, if in our, for us to, these challenges cannot, you know, be overlooked. It cannot be overlooked because if you look at the, if you talk about increasing partnerships like you mentioned, it is not a very comfortable period now to begin to look at robust partnerships and other activities. What we are going to be doing now is to refocus and prioritize those nutrition activities that can bring out immediate impact on the children. I want to agree with Ivy. We had a robust plan done, but we also need to map out how are we going to implement the plan, because it's still not being implemented. The response plan is still not being implemented. We are going to also look at, for instance, I would suggest that the most important thing to do now is to actually look at need to develop cost-effective mitigation measures. What are the mitigation measures? Like providing resilience programming for our children 0 to 5 months and 6 to 23 months. How can we harness, you know, the opportunities of educating our mothers? We are actually, UNICEF developed communication materials which some of us in the field offices used to liaise with the communication platforms in our various states to, you know, maybe kind of develop some jingles and nutrition information. But this should have been done at the onset. Like Ivy mentioned, we should have, you know, been more proactive. Partners and UNICEF and the state government should be on the driver's seat. UNICEF and partners' expectations should be to support them and to provide technical guidance. But we also need proactiveness of the government and ownership of these programs. But it's not late, because during the development of that National Nutrition Response Plan, which every partner and majority of the partners were involved, a committee was set up that will be monitoring and, you know, the activities, coordinating activities of nutrition for this. And I don't know whether they have actually, it's an opportunity for us now to latch onto the, you know, picking back on the gains already made on political awareness to ensure that nutrition is fully integrated into the presidential task force agenda, ensuring that this is a period to make nutrition visible to the government. And this is part of what UNICEF is advocating. We are doing remote advocacy everywhere we are. All the field offices of UNICEF are partnering with the government to ensure even the risk communication and community engagement platforms carries on nutrition components to ensure that information about nutrition, either using motorcades, motorized platforms, or even in the sensitization activities, nutrition should be entrenched into the risk communication and community engagement platforms. We are also ensuring that nutrition officers of all the states, we are supporting them, encouraging them to be in all the platforms concerning COVID-19. Because henceforth, COVID-19 has come to stay with us, and the effect on nutritional status cannot be overemphasized, because at the end of the day, nutrition is going to suffer more the toll of the COVID-19. And the impact assessment has highlighted that the most vulnerable people are the hardest hit. The 0 to 5 months, 6 to 23 months children mothers, pregnant women, adolescent girls will be the hardest hit. And we need to target them at this period and refocus, recalibrate our strategies and refocus on priority nutrition actions that can bring results, building community engagement, and latching onto social protection measures like safety nets that can help to bring aboard community women and traditional rulers to actually own your programs. Community-centered activity like home gardening and others, like was enshrined in the response plan, should be our focus. But I've not seen it being driven now. But I know that going forth, we are going to be doing something about that, and it's going to be yielding results. But we need an elaborate plan. We need an elaborate plan to identify changes and other related determinants that will affect nutrition, and decide and prefer mitigation measures on time, latching on to Food and Agriculture Organization, World Food Programs, and ring projects of the World Bank on nutrition, coming up with other partners and donors, and the government, of course, at the forefront.
Referencing what Ms. Onuora mentioned, there's something you said about there are challenges that we have encountered because of COVID-19 and the importance of risk communications and community engagement. You almost feel that what we need is a complete package of risk communications and community engagement, which includes nutrition, maternal health, immunization, risk communications also in terms of prevention of COVID, because that's where a lot of the risk comms is focused. So we almost need a comprehensive risk communications and a community engagement strategy that now focuses on all these health challenges that have now been thrown up because of COVID-19. Okay, so thank you ever so much to our very distinguished panelists for all their questions. What I'd like to do now is just take a few questions from some of the delegates, because I know they've been waiting quite patiently. And just skimming through them, I see quite a lot of commonalities between questions asked, like Francis Akubude was asking about the percentage of implementation of the plan, and also Mercy Fenacha was asking what are the challenges that have been encountered in domesticating NSPAN. And I think the panelists have covered those questions, at least answered what the challenges were and what level of implementation has taken place. But there's a question that, that one about our delegates mentioned, Catherine Onyemelukwe, and her question was asking, can any of the panelists provide an example of successful intervention at LGAs, at the LGA level? It's always good for us to talk about successes or examples that can be replicated. So I'm thinking who best to address this question to. Perhaps, so maybe Mrs. Onuora can answer. In your experience, or your from the work you've done with UNICEF, can you give examples of at least states, even not just LGA, states that have successfully implemented some aspect of NSPAN that has led to positive outcomes?
Many states actually have gone ahead despite the bottlenecks of funding and human resource capacity issues and states and LGAs. With the collaborative efforts, several states have gone ahead to, because in the field offices, we have built capacities of the state steering committees. And actually, I will tell you the truth, we have positive results to give from some of the states. I will use, for instance, the states in the South, the Rivers Field Office states. Like Ivy mentioned, the Delta states on the Sun Movement launch. Actually, the Sun Movement launching, I know the Delta state has established a Sun network, and the government Sun network with the civil society angle exists in the state, and they have involved the Sun Business Network, who also introduced us to the Chamber of Commerce. And the Chamber of Commerce is a core part of them, and they are working in integration, actually. So I will use examples of little programs. The state has gone ahead to establish local government committees on food and nutrition in 6 LGAs, and they are functional. The committees are actually overseeing activities to roll out, because Delta State was one of the first states that gave approval to their state-specific plan of action, the multi-sectoral plan of action and the state policy on food and nutrition adopted from the federal in 2017. And I've gone ahead to allocate funds to specific MDAs to implement and roll out this plan. And that is one success story where we are. But for the going down to the details at the LGA levels, it's only one program that I can categorically say that, like the adolescent nutrition program that is going on only in 2 states of the Federation, that is where we see collaborative efforts coming on board in actual sense at the state level and at the local government level where they're working, because the education sector, the economic planning being the coordinating body, Ministry of Women Affairs, including the Bureau of Statistics in the state. That is wonderful because they are the ones that has developed the platform, monitoring platforms for the program at the state level. We have not had much effects because our attentions are, concentrated on selecting focal LGAs. This is just to give a model to the states, to the government partners to, increase and sustain the program. But Delta State is one state that is doing it. For instance, even in the Seaman project that they just started in March, Delta State was able to provide, because they have a universal basic health trust fund, which they are giving free drugs and treatment to under 5 children. So getting amoxicillin and other essentials that are apart from RUTF was not a problem to that state. But we have not got much to be able to say this is the impact. But at least you see them coming on board. And then the establishment of platforms that monitor it, where the Federal Ministry of Health and all stakeholders, including the chairman of the executive chairman of the boards in the state. That is the amazing thing, is that the executives of the states in Delta states are interested and are participating even in community-driven activities to showcase results. We have not come to showcase results, but we know we are getting there with the level of garnered political environmental momentum for nutrition in states like Delta, in states like Akwa Ibom, including in Rivers State. But Rivers State is not majorly a place where we have service delivery, but they're still moving on. They're moving on because we have 2 champions from the states. Her Excellency, the wife of the governor, is a nutrition champion, and Her Excellency, the deputy governor of the state, who was the first MD of MPSCDA and is charged with public health here, is a champion for breastfeeding. And because of that, Rivers State was the first state to launch the breastfeeding collective in the Federation, apart from what was launched at the national level. And they are moving ahead, the breastfeeding initiative. At this time we have the COVID-19, you can see them on board, trying to decipher activities. How can we go on with the code? How can we begin to track mothers not to violate the code at this period? How can we begin to engage them at the community level? And the nutrition officers without support are moving ahead to do community sensitization, to fish out, give education to mothers on IYCF and all that. We have not, because one major problem that nutrition has in Nigeria is data. The issue of monitoring, supervision, and data generation. That is where we have our major problem. Because these things I'm talking about are not properly registered, and we cannot track it to be able to say that this is the result we can achieve. And I think it's a major area we should all look into. Ensuring that nutrition issues are appropriately entrenched into the National Health Management Information System, like it's being enshrined in the SPAM, even though it is defunct. It is in the draft multi-sectoral national plan on nutrition.
Okay, thank you, Mrs. Onuora. Thank you very much for that, Ms. Onuora. We're running out of time, so I just want to ask one final question, and then we'll round up. And this is, again, leading from your mention of data and the importance of data. And this question comes from Ojonugwa Oji. and referencing one of the objectives of NSPAN, which is to promote and strengthen research, monitoring, and evaluation. This was actually one of the most voted on questions. So clearly our delegates really want an answer to this. So this is to Dr. Chris. Looking at one of the objectives of NSPAN, which is monitoring and evaluation, as I mentioned, at the ministry level, how much do we really know what Nigerians are eating? Do we have any data that gives us some indication of the Nigerian foods and the nutritional breakdown and the nutritional composition of foods that Nigerians are eating? As we know, we have a very diverse country. So having access, or if this information is available, would actually guide a lot of nutritional programs to be more targeted at the state level.
Okay.
Yes,
there isn't a common document that's specific for that right now, but we are in the coming, hopefully before the end of the year, we shall commence the conduct of the National Food Security and Micronutrient Survey. And that survey, one of the outputs from that survey will be to have a knowledge of exactly what Nigerians are eating, because it's a national survey. That the last one was in 2001. It gave us an idea of the kind of food people are eating, but that's a long time ago now. That's almost 19 years. So the next one is actually at the planning stage. We are finalizing the pre-survey activities, and the survey will happen in 2021. It was actually, well, but if not for this COVID-19, we should be about starting that at this time. So but there are a few documents here and there. I just talked about the 2001 survey. There are a few surveys that gives you an idea of what kind of food are people eating. The NDHS gives us an idea of what we feed, what kind of food are our children eating. That's the Nigerian National Demographic and Health Survey, the Nigerian Demographic and Health Survey. For children under 5, are they eating healthy? What kind of food? What percentage of them are breastfed? What percentage of them are adequately fed in terms of quality, in terms of quantity? But answering your question specifically, I am not aware there is a book that catalogs what Nigerians are eating. By the time this survey result comes out, we'll have a good idea. There is a fact survey that is done by GAIN, and we've had about 2 or 3 editions that also looks at what is the micronutrient content, what is the availability of fortified food across the country, and how are people embracing it, what is the consumption level, consumption rate. But they are not, all of these are here and there, but by the time we come out with the survey, we'll have a documented report. Thank you.
Okay. Thank you very much for that. We're a bit short of time, so I'll just quickly round up. Thank you very much for very, very, very passionate discussion, focusing on NSPAN, but also on the wider challenge of nutrition and improving nutritional status in Nigeria. So I will just finalize by thanking our very, very distinguished panelists who agreed to take part in this important webinar. Mrs. Onuora, thank you very much, all the way from Port Harcourt. Trust you're keeping well.
Thank you very much.
Agreeing to take part in our webinar. Ibiso IB again, thank you very much for bringing that voice of the role of the private sector to this webinar. It's always good to hear those different voices and to understand the role that the different stakeholders are playing. And of course, Dr. Chris from our Federal Ministry of Health. We understand that you're quite busy over this period, especially with the COVID-19 pandemic. But we are very, very grateful also, not forgetting to mention Alive and Thrive, our very, very supportive partner who helped us in putting together this webinar today. We have a lot of focus on COVID-19, but we must not forget the other issues that remain big challenges, as Ms. Onuora mentioned. And we can't afford to lose some of the gains made by government and all the different stakeholders in the space of nutrition. So I'll just round up by saying thank you very much for taking part in this webinar. Thank you to my team, Nigeria Health Watch, who are behind the scenes helping to put this webinar together.